If you're on now, we're just waiting a couple minutes to let people join the presentation. So please stay tuned in and we'll start our presentation in a few minutes.
Nicole's watching, Gloria's watching.
15 people.
All right. Hello, everyone, and welcome to our colon cancer awareness presentation. Today, you have Katie Yonker, the community health worker out of the Niobrara office, and Miranda Kiefer.
Hello. We're going to do a quick presentation for you. We have a guest speaker as well. And then we'll do an example at the end of the kits that we're going to have available for our members. Katie, if you would like to start the presentation.
All right. So today our topic is colorectal cancer. What is colorectal cancer? Colon cancer is a type of cancer that begins in the large intestine. Colon cancer and rectal cancer are often grouped together because they have many features in common. Most colorectal cancers start as a growth on the inner lining of the colon or rectum. These growths are called polyps. Some types of polyps can change into cancer over time, usually 10 to 15 years to develop into cancer, but not all polyps become cancer. The chance of a polyp turning into cancer depends on the type of polyp. The benefits of early detection. Screening can find non-cancerous colorectal polyps and remove them before they become cancerous. If colorectal cancer does occur, early detection and treatment dramatically increases the chances of survival. Only about 4 out of 10 colorectal cancers are found at an early stage. Once the cancer has spread to nearby lymph nodes, the survival rate goes down to 70%. And if it has spread to distant organs such as the liver or lung, the rate goes down to about 13%. Regular screening can catch cancer early or even prevent many cases of colorectal cancer altogether. By finding and removing certain types of polyps before they have a chance to turn into cancer. So signs and symptoms. Colorectal polyps and colorectal cancer don't always cause symptoms, especially at first. That is why getting screened regularly for colorectal cancer is so important. If you have symptoms, they may include blood in or on the stool, stomach pains, aches or cramps that don't go away, unexplained weight loss. Some risk factors include those who are ages 50 to 75. More than 90% of all colorectal cancers are found in people who are 50 and older. Family or personal history of colorectal cancer, rectal cancer, or polyps. A personal history of inflammatory bowel disease such as IBD, IBDs such as Crohn's disease or ulcerative colitis, People who are at a higher risk for colorectal cancer may need to begin testing when they are younger. So ask your doctor when you should start getting tested. Other lifestyle risk factors for those under 50 may include those who are physically inactive, overweight or obese, a history of type 2 diabetes, racial or ethnic background, who use tobacco, often drink too much alcohol or consume lots of red and or processed meat.
And then at this time, we're going to introduce Sarah Pfeiffer. She's going to talk about some nutritional facts to help with the risk factors.
Thanks for the introduction, Miranda. So as Miranda said, today I'll talk about a little bit how nutrition plays a role in reducing risk for colorectal cancer. So according to the American Cancer Society, about 18% of cancers that are diagnosed in the U.S. are actually related to excess body weight, physical inactivity, excess alcohol consumption, and or poor nutrition. So those are all preventable. So what does the research actually say about diet and colorectal cancer prevention? So one of the biggest things when we're looking at nutrition and risk reduction for colorectal cancer is adding in more fruits and vegetables. So eating lots of fruits and vegetables and whole grains, there has been links between that and decreased risk of colon and rectal cancer. There's also an increased link of risk between colorectal cancer and increased amounts of processed meats or red meats in the diet, such as beef, pork, or lamb. In some recent years also, some large studies have been showing some conflicting evidence that fiber in the diet may also lower colorectal cancer risk as well. So research is still underway in this area, but that may be something as well to look at in the future. So they're looking specifically at whole grain intake as well, and if we should be increasing our whole grains in our diet. Some studies also have looked at different vitamins and minerals that may help reduce our risk for colorectal cancer. So one such study, or actually multiple studies, have looked at multivitamin use and folic acid. So some have actually shown that it helps decrease the risk, but then there are some studies that have hinted that folic acid may help actually increase the growth of existing tumors. So there is more research needed in that area. There is a link between vitamin D and colorectal cancer risk. So there have been studies suggesting that vitamin D can lower or may lower colorectal cancer risk. So studies have shown that low vitamin D levels are associated with an increased risk of colorectal cancer, as well as other cancers. They are suggesting, though, instead of sun exposure, because that can increase our risk for skin cancer, to get that rather from a vitamin D supplement. So it's important, or it can be important, to talk with your doctor about whether a vitamin D level should be tested if it's low, and whether or not you should take a vitamin D supplement. Another mineral that has been linked in studies to colorectal cancer is calcium. So low levels of dietary calcium intake have been linked to an increased risk, or also other studies have shown that increasing calcium intake may actually lower the colorectal cancer risk. So that is important for a number of reasons besides the possible effects on cancer risk, but because of the possible increased risk of prostate cancer in men with high calcium and dairy intake, and the possible lower risk of other cancers like colorectal cancer and breast cancer, the American Cancer Society does not actually have any specific recommendations regarding dairy food consumption right now. Another nutrient that has been linked with colorectal cancer risk is magnesium. So there have been a few studies that have shown a possible link between a diet that's high in magnesium and reduced colorectal cancer risk, so especially among women. But more research is needed in that area. So given all of this information, what can you actually do to help decrease your risk for colorectal cancer? One, having more vegetables. So doing things like including vegetables at breakfast, trying to make half our plates for each meal to be vegetables, such as with salads. Steaming vegetables in the microwave can be a simple way to get in more vegetables in the diet. or, you know, oven roasting on a sheet pan, doing some sheet pan meals as well. Also, number 2, increase fruit. So fruit intake, we should try to get the average person should get about 1 to 2 pieces of fruit a day. So that can be, you know, if there's snacks, we can get those, including in breakfast, possibly making some fruit smoothies. Third thing we can do is try to increase our whole grain intake. That'll also help increase our fiber intake. So oatmeal, trying to get in 100% whole grain, maybe breads and pastas, brown rice, trying to incorporate those things in our meals. Another thing, the 4th thing we can try to do is swap out red meats for other types of proteins such as poultry, fish, or plant-based proteins. So we also want to try to limit those processed meats such as hot dogs, lunch meats, and summer sausage as much as possible too. And lastly, you know, we did talk about a different number of supplements, so maybe talking with your doctor about if a supplement would be right for you, especially vitamin D, getting those vitamin D levels checked for multiple reasons. Vitamin D can benefit a person's health, so talking to your doctor about taking a vitamin D supplement may be helpful as well, and decreasing risk.
All right, thank you, Sarah.
Thank you.
Again, thank you, Sarah, for that information. And I would just like to point out, if you have any questions, feel free to put them in the comment section. We will get to them later. And also, please do not ask any personal questions, as we do not want to violate HIPAA. Thank you.
So why is it important for Native Americans to get screened? Native Americans are more likely than other patients to present with advanced stages of breast, cervical, and colorectal cancer. Colorectal cancer is the 2nd leading cause of death among cancer from Northern Plains Native Americans. Colorectal cancer is 53% higher in Native Americans of the Great Plains than non-Hispanic whites. Some colorectal cancer screening tests include the fecal blood test, which should be done yearly. Your doctor will give you a test to take home, and you can do in the privacy of your home, and then you can bring that kit back to be tested. The indication of blood in the stool does not indicate that you have cancer. It just means that there may be a polyp, a non-cancerous one, but it does not necessarily mean that it is cancer. And another colorectal cancer screening test is a colonoscopy, which should be done every 10 years if you have had history of polyps before. And then some colorectal cancer prevention is to get screened, maintain a healthy weight, keep and stay physically active, eat a healthy diet like Sarah has said, eat whole grains, fresh fruits and vegetables, avoid processed meats, and then limit your alcohol and tobacco usage. And now Miranda's going to do a little presentation on how to
Use one of our kits.
Yeah.
And these kits will be available at our Fred Leroy Health and Wellness Center, and then also at Ponca Hills Health and Wellness Center. And then also, you can contact your community health worker at each one of the offices, as we have some available to hand out as well. And so, with these kits, you'll get this little envelope. It has everything you will need inside, and it also has mailing instructions. You do not have to personally mail it. You can bring it into one of the offices closest to you. And we are giving these kits out to people in the service delivery areas, because on the flyer, I'm not sure if you noticed, there is a raffle for people who complete these. They do have to be completed and brought back in. So we have a TV available.
Smart TV,
It's a smart TV,
32 inch.
32 inches. And there are a few other prizes as well. So it's not just that one prize. So you do have a good chance of winning something. And with this kit, it's pretty simple, and with this year we do have these hats available for individuals that may need these instead of just the paper that's available in the kit, because this is flimsy. But then this would just sit in your toilet to help you have more support for the sample. And when you're doing this, you want to make sure that you urinate first before you start with the paper or the hat. Okay, so you'll get your kit. It'll come just in this envelope. You can take everything out. These are your sample papers. It does come with instructions, easy to read instructions, very easy to follow. They are also bilingual. So on this side, Spanish, English, and then you'll follow that step by step. First thing, like I said, you'll want to do is you'll want to urinate, because you don't want any urine on the sample. And then on this little tube that comes in this clear little bag, it pulls off right here. There's this little yellow tab. You pull it off. You don't have to put all this information on here, just your name and your date of the sample. And then you just roll that back up, set it aside, and then, like I said, it comes with these pieces of paper. Now they do have sticky on them to help you stick them to the toilet bowl once you put them over the opening in the toilet. It's like that. And then this is our toilet bowl lid. So you'll put this over it, like so, so it'll be like that. Then of course you'll go to do your business. Whoop. There you go. That's what we need right here. Okay, we got our stool sample.
Please tell them it's clay.
This is made out of clay. I didn't
It's not
dig it out my toilet this morning, so we're good. So then you'll unscrew your little tube here that you put your name on and the date, and it's just this little pokey, and you'll want to poke your stool sample 6 times in different areas. And then once you do that, of course, put it back in the tube. Put the tube back in your little baggie. Now this baggie does also have the little sticky on it, so you can remove the sticky, secure it in there. And then you'll want to, before you put it in here, this is a very important step. On here, you'll want to put your name on here also, so we don't get them mixed up when we get them back from you. And then the date as well. So then you'll put your sample back in this pouch after your name and the date are on it. And then this also has sticky, so you can close it up. And then, like I said, you yourself do not have to mail this. You can bring it into one of our offices to the clinics, or you can call your community health worker directly and let them know, hey, I have my sample done, may I bring it to you? And we will figure that all out and set up a time for you. And then we will take it to the clinic for you, if that's a better option. Now with these kits, then you can just, flush the toilet and
Yeah,
go about your day.
these papers are safe to flush, so you don't have to touch that or anything.
Right.
Biodegradable.
And then for the kits, there are some, you have to be 50 years or older. Generally 50 to 75 years old is the screening range. But if you do have the risk factor in your family of colorectal cancer or colon cancer, we would just need maybe like family history of that, and then you can get the kit. Or if you're younger, you can even just go to the clinic and tell them, hey, I want to do a kit because, I'm worried, it runs in my family, and they will gladly give you one. And then, like I said, we're gonna do a raffle this year, so we're excited about that. Nancy worked hard on that and got us the TV and some other great prizes. So, and if you have questions, again, please comment them in the comment section. We do not have a professional, medical professional here right now to answer them right this moment, but we will get them answered for you. And please refrain from anything too personal, as we don't want to violate anybody's rights. So,
Also, let them know if they don't know if they qualify or not, they can reach out to us, or
Yes.
they can call the clinics.
yes, and good point. Nancy said that if you do not know if you qualify, please reach out to one of us or the clinics. Katie is in Niobrara. I am in Norfolk. My name is Miranda. And then we also have Nancy Velasquez, who's in Omaha. And then we have Nicole, and she is in Lincoln. And then I also cover Sioux City. And Katie also helps cover Sioux City. So wherever you are in the service delivery areas, please reach out to us so we can help fight this and keep it down amongst our people.
Do we have any questions?
Any general questions that we may be able to answer?
None yet.
Should we explain our question?
You can go ahead and explain it, how our little polyp party back
Yeah.
here.
Our theme this year was don't let the polyps start the party without you, so we had our decorations and our little disco ball and our polyps, so.
Yes.
We had an example, that these are polyps, and if untreated, they could become cancerous, and so, what happens when you don't treat cancer is that,
Yep. It spreads, and we do not want that for you. So please, we about gave our boss a heart attack in the back, if you're wondering. But just trying to make it fun. We are so sad that we cannot be in our groups person to person with all of our people. So we miss y'all. Thank you for tuning in. Again, any questions, any concerns, you always know you can reach out to us. We're always available for you, for all your needs, because we are your advocates. So,
Remind them once again how they enter the raffle, just for anybody who might have missed it.
yes, and again, anybody, come get a kit, 50 to 75. Maybe younger, could be older if you would like. If you're younger, usually it runs in your family history. And then once you return the kit, after you get it from us with the sample in, we'll run it. One of the doctors will let you know the results. And then we are keeping track of everybody that turns them in, that gets one. So we will be able to keep your name for the raffle, which will be at a later date, so we can give everybody time to get these from the sites, do their duty. Yeah. And then bring it back to us.
Okay, we have a question, and I don't know if you guys know the answer to this or not, so I may take it.
Okay.
What's the difference between polyps and hemorrhoids? If you guys don't know, I can answer it for you.
Okay, go ahead, Nancy.
All right, so hemorrhoids are usually on the outer part of your butt, so to speak. They're swollen veins. Doctors can immediately distinguish between hemorrhoids and polyps.
polyps are a growth, so, usually kind of like a type of cyst or tumor inside of your colon. As hemorrhoids, Nancy said, are usually,
on the outer
On the
Yeah.
outside of your rectum.
of the anus. And then polyps too will be removed during a colonoscopy.
That's a good question.
Very good question. Do we have any other questions? Nothing yet?
This is so different than being in person with our people.
Well, you guys got a lot of compliments on good presentation, so hopefully
Well, thank you.
everybody enjoyed our presentation.
Nervous as ever, but I'm here for you. And I'm really disappointed, everybody, because I got these blowers and they don't make noise. So that's why we didn't really use them, because what's the fun in that? It's no party if there's no noise.
My party.
But do people really want a party in their colon?
No, they don't. That's why we're here, to let them know. Come get a kit.
Early detection is important, guys. Especially colon cancer. It's such a curable cancer when it's caught at such an early stage. And as simple as, you know, the FIT test, I mean, if you qualify, I would highly recommend doing the kit, because it's such a simple, ininvasive test that's, you know.
Beneficial to you. Yeah, for sure. Any more questions, Nancy?
We do have a question. Nicole is asking, how do you know if it's blood in the stool or hemorrhoids?
Well, usually the lab will be able to detect if there's blood in the test, and then further testing will. So usually, if you do have a positive FIT kit, they will usually do more testing to determine. So that may require some additional testing, as in a scope or a colonoscopy, to further examine whether that is a polyp, and if that can be removed, or if it's just a hemorrhoid. And usually your doctor will be able to let you know.
But then also too, excuse me, depending on how your eating habits are, your stool may be very hard, and there could be some straining
Yeah.
when going to the bathroom, and that can cause bleeding too also.
And that can all be deciphered with the kit, with the medical professionals, so.
So just because you see blood in your stool or in the bathroom, in the toilet, don't immediately jump to it's colon cancer,
Right.
but always keep in mind that you should be checked by your doctor. Do not let it go unchecked.
Yes. Very true.
When in doubt, see your doctor.
Absolutely.
Okay, we have another question. Can ulcers cause blood?
Yes. Yes.
Yes, they can. You can have a bleeding ulcer
Yes.
that will
And
have
those
to
aren't
be
fun
determined by
either.
your doctor.
Those aren't fun either.
We have another question. How long does it take for a polyp to turn into cancer?
It can take up to 10 to 15 years. So, like I said, there are different types of polyps. I had them in my slide. I didn't really go too in depth with them because I'm not a medical professional. But usually, like I had stated before, some of the early signs, especially or in the early stages, you might not even show any signs or symptoms. So, but they're usually 10 to 15 years for a polyp to develop into cancer, if not earlier, depending on the type of polyp it is.
And that's why these kits are so important, because they'll detect that blood in your stool.
And then also for those patients for those people who have a history of colon cancer, excuse me, you can start at around the age of 45. And each colonoscopy that you have will determine the length of period of time to return for your next colonoscopy.
Usually those who have had cancer before usually have to have like yearly screenings, those who've had, colonoscopies and have not found polyps, usually every 5 to 10 years is what the,
Well, I'm going to speak from personal experience. My grandmother had passed away from colon cancer. And I received my first colonoscopy at 45. And I went back every year for 4 years for a colonoscopy. And if they find polyps, you keep going back every year. If you're polyp-free for 2 years, they will let you come back 8 years later. So, it all depends, the doctor will make that decision if it's between the 5 to 8 to 10 year mark, if there's a history of colon cancer in your family. We do have one more question. What does colon cancer BMs look like?
usually because of the growth, I did have a picture. The poop will usually either have blood in it, it'll be usually soft and kind of narrow, discoloration of the stool, so either darker because of the blood in the stool, but just not your normal, I guess,
Semi-solid.
yeah, semi-solid, semi-soft, brown.
Yeah.
So,
And it can also be kind of gel-like.
yeah, I said it's really, yeah, like, would you say mucus, kind of?
Mucusy,
Oh,
thank you.
mucusy.
That is exactly the word. It can be mucusy, but in a brownish color.
So yeah, so usually the growth in your colon is blocking some of that bowel, so it's not gonna come out in like a normal form that it would.
We don't have any other questions. If they have any other questions, they can feel free to leave them, and we can also have Dr. Heller or Jason or Maria answer them too at a later time.
Yes.
All right, thank you for tuning in, guys.
Again, if you need a kit, come to one of the clinics or reach out to your community health workers and come pick one up, bring it back, or have one of us, give it to the clinic for you. If you're in Sioux City, I do know that none of us are really there all the time. Cindy does have them available in the office for you to hand out. So they're available there as well.
And let's also remind them, starting next Wednesday is our CHW Behavioral Health collaboration of Mental Wellness Wednesdays.
Yes.
They can tune in at 11 o'clock every second Wednesday of the month.
Yes, please do.
That's all I got.
All
All
right.
right.
Thanks, everyone.
Thank you.